Good evening once again. So this will be our first CPD lecture of the year. Welcome to all the members and welcome to our guest speaker, Dr. Chamunorwa Marufu. He'll be presenting to us on the effects of finishing and polishing protocol on the color stability of dental resin composites. Dr. Chamunorwa Marufu qualified from the University of Zimbabwe in 2007, and he went on to do an MDS in prosthodontics at the University of Nairobi, finishing education in 2020. Currently, he works at the University of Namibia in the faculty of Health Sciences and Medicine, School of Dentistry, as lecturer for prosthodontics and dental materials. Marufu for his presentation.
So good evening, everyone. Can you confirm if you can hear me and whether you can see my screen?
Yes, Doc, we can see your screen.
All right, so the topic of my presentation is the effect of finishing protocol and staining solutions on the color stability of dental resin composite materials. This presentation is based on a study which I did when I was at the University of Nairobi by the same title. And this article was published in the Journal of Clinical and Experimental Dental Research in March 2022. All right, so dental resin composite are perhaps the most important direct restorative material in our clinic. Nowadays, we use it for both anterior as an aesthetic restoration and also the posterior restoration because of the phase down of amalgam due to mercury concerns. The longevity of this restoration, according to literature, varies significantly, but it's generally reported to be around 6 to 10 years. And the failure behavior, however, is different for anterior versus posterior composites. For posterior composites, the main reasons for failure are secondary caries and fracture, whilst factors related to aesthetic, for example, color alterations, are common for anterior restorations for obvious reasons. Replacement of these restorations due to the discoloration, as reported by various sources, is from 5 to 37%. Though unfortunately, all of this literature is of studies done in Europe and other mainly first world countries. We generally don't have data for failure of composite restorations done in Zimbabwe currently. So I am not sure whether the same data is relevant to our setting. So factors which affect this longevity include patient factors like oral hygiene, smoking habits, diet, and physical properties of the restorative material, meaning the quality of the restorative material, and obviously the skill of the operator. When we look at color stability of dental resin composite restoration, the discoloration can be classified into intrinsic and extrinsic discoloration. The intrinsic discoloration is related to the material's composition. That is, for example, a filler type. It is known that, the matrix, it is known that matrix with a lot of hydrophilic monomers will tend to absorb pigment from the diet more, resulting in more discoloration. The matrix, we know that composites with larger particle size of the fillers are more difficult to polish, so they'll tend to absorb and stay more and discolor more. Also, the amount of photo initiator system, this would apply both to light cured system and also self-cured system. The light cured system, which are the ones we commonly use in our clinics, we know the most common photo initiator is camphorquinone, and unconverted camphorquinone tends to cause a yellowish discoloration in the restoration, and also the percentage of carbon double bonds. So as I said, the intrinsic factors are related to the material's composition. And so except due to improper light curing, intrinsic discoloration depends on the manufacturer's formulation. On the other end, extrinsic discoloration, this is where we have the absorption of staining agents onto the restorations. An important determinant of the extrinsic discoloration is the finishing and polishing protocol, which is what I looked at in my study. The other factors which affect the extrinsic discoloration are oral hygiene of the patient, eating, drinking, and smoking habits of the patient. Though please note, more than one factor may be responsible for the color change. On the finishing and polishing, there are a lot of materials recommended for finishing composite restorations. The benefit of finishing and polishing include oral health, as in a smoother restoration will tend to retain plaque-less function, as in smooth surfaces will make it easier for the foot to glide, and then aesthetic, that can, for instance, the way the restoration is going to interact with light, as in the optical properties of the restoration. And then because of their nature, being composed of a resin and inorganic fillers, composites are difficult to finish and polish to a high luster. The finish of these restorations depends on the filler type, particle size, morphology, and loading and type. Though one study by Esselton reported that even when finished in exactly the same way, these composite restorations would sometimes have significant differences in the finish. And curing composite restoration in contact with a mylar strip is known to provide the smoothest finish. In color measurements, when we are doing studies on color in dentistry, we tend to use what is called the CLAB color system. This color system is quite similar to the Mansell color system, which we're all familiar with. Remember the Vita shade guides, or indeed all of the shade guides which we use in the clinic are based on the Mansell color system. The difference will be the way in which each point in the color and the color system is defined. So this CLAB color system is way more sensitive to color changes compared to the Mansell color system. That's why it's favored in most dental researches, though there are some which use the Mansell color system. In this study, we use the CLAB color system, and we use the spectrophotometer to measure the color changes. So when you measure the color using this system, the color is measured at 3 coordinates, which are designated L star, A star, and B star. And then the color difference between 2 points, to get the color difference, you now simply separate the initial to the final color coordinates, and then you find the square root of that, and that will be designated delta E, as in delta E is the color change. So the statement of the problem for the study was restorative dentistry is invasive and irreversible, and an irreversible procedure, meaning that failed restorations will need to be replaced. So this puts the tooth in a restorative cycle, or rather this accelerates the restorative cycle, which might eventually result in the restoration failing and the tooth needing to be extracted. The broad objective was to evaluate the effect of surface finishing protocol and exposure to staining solution on the color stability of dental resin composite restorative material. And then the specific objectives which we are going to look at in this presentation were to determine the effect of surface finishing protocol on the color stability of nanofill and micro hybrid dental dental resin composite restorative material, and two, to compare this color stability of micro hybrid and nanofill dental resin composite material subjected to different finishing protocols with different staining solutions. So the method I used for this study, we used the protocol recommended by ISO 7491, which is used in the determination of color stability of dental materials. This standard was reviewed in 2017. Apparently, they reviewed these standards every 5 years. The only thing which we couldn't get was from ISO 7491 was the sample size. So the sample size we used was determined from similar studies which have been conducted elsewhere. So the resin composite materials which I evaluated was Filtech Z350 XT, which is a nanofill composite from 3M, and Vital Essence, which is a micro hybrid composite from Ultradent. The monomer matrix for these two seems to be similar. The difference though being, the content of the resin versus the filler. For the nano composite, the filler was 63.3% by volume, and for the micro hybrid, the filler was 52% by volume. And then for this study, we used material from the same batch, which is indicated there, and those were the expiry dates of the two material. And that's a picture of the materials which we used. And then the finishing and polishing materials which we compared were the Soflex discs and the white polishing stone. Though please note this picture was taken after the studies. That's why you find there is some wear on some of those bays of those on those polishing stones. And then we also compared the mylar finish, as in the composite material is cured in approximation with a mylar strip, which remember from our literature review, which we just looked at, that would give the smoothest finish possible. And then the staining solutions were tea and red wine. Please also note red wine was also used as a positive control because there were a number of studies which indicated that red wine would actually cause discoloration. And then the negative control was distilled water. In addition, we also tested the cut plant, which is also called Mira in some Eastern African countries. This plant is not that popular in our setting in Zimbabwe, but in East Africa and and the Middle East. It is quite popular. It is actually considered as a drug abuse by the World Health Organization. But in countries like Kenya, where I was, use of cat is legal, though it is banned in some countries. So the tea solution, you just simply prepare tea based on the manufacturer's instruction. And then the red wine was used as it is. And then for the cat, we had to make a plant extract. We followed the methanolic plant extract, which is used in most studies which utilize plant extracts. So how we get the extract is you'd actually chop the cat into small pieces, you mix it with the methanol, and then you put it in a sanicator, and you get, and then you filter to get the solution indicated in the first picture. And then the next thing will be to get rid of the methanol, and you do that using a sonicator. And then you end up with a paste which is shown in the picture on your right upper corner. And then you factor in the dilution ratio to come up with the plant extract as shown in the lower left corner. So this plant is, chewing this plant is actually popular in these countries because it is considered a stimulant. So you'd find that people who have, like for instance, long distance drivers, truck drivers, or even bus drivers, and also sometimes students during the exam time, they would actually use this cut, and they would chew it for, as reported by some studies, on average 4 to 5 hours a day. So once we got the solutions, we then went on to measure the pH as shown there. So the pH of the tea and the cat is comparable, but that of the red wine is quite low. And then the composite solution, composite specimen preparation. Again, this was after the study. That's why you find that the discs, the composite discs, look discolored. So we used a mode to prepare these discs, and we tried to standardize the protocol in which they were prepared in, that is in terms of the curing times and the curing light. We actually prepared a jig to mount the curing light so that we minimize the number of confounders. And this specimen had a piece of floss attached to it, and we use it to tie the tag to identify each specimen, and we'll also use the floss to suspend the specimen in the staining solution. And then the staining durations were those indicated there, which is 6 hours, 24 hours, 2 days, 4 days, 7 days, 10 days, and 14 days. And after each, so initially we measured the color before we started the staining process to get baseline measurements. And then at each interval, we'll actually use a toothbrush to clean each specimen for around 30 seconds, and then we'll rinse it with distilled water. And so the results, just to briefly to explain what the graph you are going to be seeing in the upcoming slides. The two markings, first, so that the color measurements make sense to all people who are not familiar with color. There was a study done by Douglas and colleagues in 2007 where they determined the tolerances of these color changes. So the green mark shown on the graph, which is 2.6 units, that is the perceptibility threshold, as in it's a point at which we can see with our naked eye that there is now a color difference from the initial color. And the red mark above, the red arrow on top, is the acceptability tolerance, which is 5.5 units from this study. So Douglas actually performed this study on dentists. And so these marks are points at which, like for instance, the perceptibility mark is the point at which 50% of the dentists in the sample study could discern that there is a color change. And then the top part, which is the red mark, is the point at which 50% of the dentist sample would recommend that the restoration be changed. After at that point, the discoloration was not acceptable. And then on the line graph, we can see the we can see the error bars at each point. So the first reading was done at 6 hours. So this is compared to the baseline, and then the next at 24 hours and so on. And each group had 5 specimens, and the error bar still shows the variance in these specimens. And then so this will just be comparing the two material, and then the graph will be the microhybrid, which is Vitalicens. And then the orange line would indicate the color change in the Filtech, which is the nano composite. And then the 2 lines at the bottom, these are the control groups. Same materials as in the blue is still for the Vitalicens, and then the orange is for the Filtech, but these were in the control group, which I've already said it was water. All right, so now on the first specific objective, which is comparison of the type of resin and composite, of resin composite and color stability. All right, so this is the mylar finish group. Sorry. All right, so this is the mylar finish group. And as I've already said, in these graphs, the orange is the Filtech and the blue is the Vitalicen. And then these 2 lines indicate the control groups. So these 2 samples were placed in red wine, which was the staining solution. And you can easily see that the microhybrid, which is stained way more compared to the nanohybrid, which is the Filtech, which is common to all the graphs except this one, where there was a statistically insignificant difference in the 2, but either way, the final result, in this case, the final result showed that the Vitalicens was actually slightly more color stable compared to the nanohybrid. But these other 3, where the specimen had been finished, had a mylar finish, the nanohybrid was more color stable. The second group, this was finished using Soflex disc. So you can note that obviously the color difference in this, the color change rather in this group is way lower than what we saw in the previous slide, where we showed the results for the mylar finish. And also you can note that the variance, the error bar, the standard deviation is way less in all the experimental groups. The color difference was comparable, as in there was no statistically significant difference between the nanohybrid and the nanofil and the microhybrid when they were finished with Soflex disc. And also they were way more color stable compared to the scenario with the mylar finish. And then finally, the white polishing stone in this case, still remember range is the nano composite, and then the blue is the micro hybrid composite. So with the white finishing stone, these three graphs, number 1, number 2, number 3, indicate that the micro hybrid was more color stable compared to the nanofill composite. So the conclusion from this set of results, the nanofill composite specimen were more color stable compared to the micro hybrid composites when finished with the mylar strip. And then the micro hybrid composite was more stable for white polishing stone. And then there was no statistically significant difference when finished with softless disc. But however, the samples finished with softless disc were way more color stable compared to the other two. And then on the second specific objective, as in the effect of finishing and polishing protocol on color stability. So in this case now we have 3 lines, and then these arrows still indicate the same scenarios as in the acceptability tolerance and the perceptibility tolerance. So we were testing 3 materials, which is the softless disc, the mylar finish, and the stone. And then in these graphs, the stone is indicated by the gray line, and then the softless disc by the orange line, and then the mylar finish by the blue line. And so it's slightly different from the previous graph, because now we are actually comparing the 3 different polishing protocols. So for FuTech, which is the nano composite, besides this group, which was in red wine, the 2 groups, one in T and then the other 2 in the cut extractor, the softless disc finished specimen displayed the least color change. And then the samples finished with the stone, as shown there, displayed the most color change. The scenario is, however, slightly different for the micro hybrid composite. Still, as the case with the FuTech, the specimens finished in softless polishing discs were more color stable compared to the other 2. But in this case, the specimens finished with mylar, as in the mylar finish, displayed the most color change. That is, they were least color stable. And this is the same pattern shown here for the FuTech and for the Vitalicens composite specimens. So from these graphs, the microhybrid group, in the microhybrid group, rather, the softless disc finished specimen demonstrated the least color change, whilst mylar finished specimen demonstrated the highest color change. And then in the nano composite specimen, the specimens finished with white polishing stone demonstrated the highest color change in all the staining solutions, whilst softless disc demonstrated the least color change in all staining solution, with the exception of the red wine group, which I showed you earlier. So now the clinical significance of the study results. So obviously, these results may not be directly applied to the clinical situation because of the nature of the staining protocol, as in we continuously soaked the composite specimen in the staining solution. And then also the lack of the effects of the complex oral environment. And also we couldn't account for habitual effects like brushing or the effect of other foods which might be consumed, and also other habits like smoking, etc. However, within the limitations of this study, clinicians may execute best results if they finish a microhybrid and nanofill resin composite restoration with Soflex polishing discs as compared to polishing stone or mylar. Yeah, thank you. So acknowledgements, I want to acknowledge my supervisors when I was doing these studies, Dr. Kisumbi, Dr. Osiro, Dr. Otieno, and Dr. Dimba. And then we declare no conflicts of interest. And those are my references. Thank you.
Thank you very much, Doc, for that academic presentation. So at this point, we will open up the floor to questions for Dr. Marufu. If there are any questions, you could either type them out in the chat or you can raise your hand and unmute. Okay, Doc, I think I'll start with a question. In a clinical setting, after one has done a composite restoration and has polished, is it necessary to tell the patient to avoid eating or drinking stained foods or beverages for a certain period of time? Is that sound clinical knowledge to give to patients?
Well, yes, Doc, actually from the recommendations of the study, we think it's best to advise patients to take a potentially staining food in moderation after they've had these aesthetic composite restorations.
Okay, thank you, Doc. Is that in moderation? Is there a specific time period for that, or is it for life?
Well, as long as I suppose as long as the restoration exists, because of their nature, composites are unlike porcelain restorations, which are fairly color stable. Composites, with time, they would tend to discolor because of, like I said earlier, the issues of the type of resins used in this composite and also the other components. So I think it would be good to advise that as long as the restoration is in existence, the patient should take these foods in moderation.
Okay.
Just to add to that, another recommendation was, because sometimes this is the stage which is taken for granted by most clinicians, whether due to issues of time pressures, or hesitance to invest in good polishing protocols. The reason why I chose these two, rather the three polishing systems, that is the white stone, the Soflex discs, and the mylar finish, is the way the finishing protocols which we're using whilst at school. And obviously, polishing stones are more economical compared to a system such as polishing discs. So because of that, some dentists might be hesitant to invest in a good polishing system. Yeah, so the advice is, if you are going to be doing composite, or rather the recommendation is, if you are going to be doing composite restorations in the anterior region, it might be best to invest in a good polishing system, and also other aspect of the restorative procedure, which I didn't mention in this presentation because of time. Like, for instance, the curing. In an earlier slide, I mentioned that intrinsic discoloration was due to the manufacturer's formulation, but the operator can also cause that if they don't completely cure the composite. And also remember that the degree of conversion in direct composite is around 50 to around 65 degrees. Sorry, 50 to 65%. So it would also be wise for dentists when they're doing this type of restoration, to invest in a good light curing system. Thank you.
Okay, thank you, Doc. So there are two questions in the chat. First one from Dr. Tendi. Are some of the polishing kits found locally, not to advertise for any supplier?
So are these polishing kits available in Zimbabwe? Is that the question?
Yes.
Yes, I've seen them in surgery, and I know definitely there are suppliers for Soflex discs. And then the mylar finish, this is just those cellulose strips which we use to make interproximal, to make a class 3 and class 2 interproximal restorations. So definitely, I've also seen polishing stones in some surgeries. So definitely all these polishing systems are available in Zimbabwe. Maybe what you might want to do is to carry out a survey and find out which polishing systems are popular in our setting, and also possibly look at the type of composite materials which most dentists use for these anterior restorations, and also maybe look at potentially staining foods which we have in Zimbabwe. In this study, because Catomira is quite popular in East Africa, I chose that. But I'm sure there are some foods which can be potentially problematic in our Zimbabwean settings. And then once we do a survey of that, it would be nice to carry out a similar study and note which protocol results in the best color stability.
Okay, thank you, Doc. So if anyone has any leads for Dr. Tendi, they can get in touch with them or point them in the right direction. The second question is coming from Dr. Chironga. What would be the explanation for high color instability with the mylar finish, since it's the most smooth surface finish possible?
All right. So for mylar strip, in as much as the mylar would exclude the oxygen from the restoration, preventing the formation of an oxygen-inhibited layer, which we know causes problems like this. Some others have reported that the composite material underneath the mylar strip has a higher content of resin compared to composite material deeper within the restoration. So in as much as it gives you a very smooth finish, still that resin, because the resin component actually plays an important role in discoloration of these composites. You would note the resins which are usually used in most of these are BCMA and maybe urethane dimethacrylate, and these are heavy molecules. They have a high molecular weight, so they are quite viscous. So in order to increase the filler loading, the manufacturers would add resins with a lower molecular weight like triethylene glycol-dimethacrylate. And unfortunately, this particular monomer has hydrophilic groups on it. So the other heavier chains are hydrophobic. So it is these monomers which are hydrophilic, which now encourage absorption of these stains into the restorative material. So when you have a situation where a resin, there is more resin in composite, it's most likely expected that the the restoration with discolor more. I'm sure you have noted that nano composite was more color stable compared to the micro hybrid when it finished in Mahila. And as I said earlier, the nano composite at 63.3% volume of the fillers compared to the micro hybrid, which is like 50, I can't remember exactly, 55% thereabout. And just to add on that, maybe something which you might also want to consider looking at, dentists sometimes when they do anterior composite, they have a tendency of placing bond, maybe you're using a plastic instrument and then you dip it in some bond and then you apply it on top of the composite to be able to nicely adapt the composite. Remember, the bond contains similar resins, of which there's a possibility that in so doing, actually altering the resin component of that surface area. This is just something I'm noting from speculation, as not something which I have seen a study looking at, but potentially it's something which you should be cautious of when you are doing these anterior restorations, as in it might increase the resin component and increase the discoloration, the chances of discoloration of the restoration. Thank you.
Okay, thank you, Doc. I trust that Dr. Chironga's question has been answered. Are there any other questions? Okay, if there are no other questions, I'd like to thank you, Dr. Marufu, for your presentation. It was brilliantly executed. In terms of any other suggestions for polishing kits or any leads like that, I'm sure we can all share on the WhatsApp platform. But as for this presentation, I think we can call it a night.
All right. Thank you, Doc.
Okay. Thank you very much, Doc, and good evening.
All right. Thank you, everyone, for tuning in, and have a good evening also.
Okay. Thank you, Doc.